Hello, my name is Jacqueline Hurst and I'm a fully qualified acupuncturist with over 14 years of experience. I work from my own clinics in Leamington Spa and Coventry, and I'm a member of the British Acupuncture Council, and I adhere to all of the clinical standards that are required by them. Firstly, a little bit about the history and philosophy of acupuncture. Acupuncture is part of Chinese medical practice alongside herbal medicine and shiatsu massage. The medical books on acupuncture were originally compiled during the reign of the Yellow Emperor. Acupuncture has been practiced for about 4,000 years. It operates on the principles of the meridian system. At the time, the human body was seen as a small principality or country. Each organ had an official to take care of it. For example, the stomach official is called the official in charge of rotting and ripening, so that you can see that even back then there was a great insight into how the internal organs worked. Each organ has its own meridian. There are 14 channels that run throughout the body, much like pathways, and along these pathways, qi or energy travels, much like veins and arteries carry blood. There are over 600 points all along these channels that are like little pools of energy, and by inserting a very fine disposable needle we can change the flow or quality of the qi. Sometimes when there is pain or blockage in the energy flow, we will need to either tonify or help the energy move, or sedate, or disperse an accumulation of energy. I can also use electroacupuncture, where very small electrodes are attached to the needles to pulsate. This is extremely helpful when trying to move energy. The first question that many patients ask is, does acupuncture hurt? The answer to that question is no. It may feel like a sting occasionally, but usually once the needles are in, you feel very little. You may just relax and go to sleep depending on what we're treating. There is usually no blood drawn. I thought that this would be a great opportunity for me to give you a brief introduction and insight into what you might expect on the first visit with me for acupuncture treatment. Your first treatment lasts for about an hour and a half, then subsequent acupuncture treatments last for 1 hour. Your first treatment will consist of us sitting down together and going through a traditional diagnosis. This is a fact-finding mission. I will ask all about your health, medical history, lifestyle, even going into what time of day and year you feel at your best. I will also be looking at your diet and sleep patterns. It is all this information that helps me understand how to treat your condition. Then I will ask you to undress and sit on the treatment couch. After a short physical examination, taking pulses and checking your tongue, we will start to needle. The first needles are very superficially inserted into points on the back. This is called a drain. This is a detox treatment that will allow us to begin with a nice clean meridian system. Then, during that same treatment session, we will also begin to work on your condition. Once your condition is sorted out, many people decide to come for a seasonal tune-up. Every time the season changes, you can pop in for a treatment. Chinese medicine, unlike its Western medical counterpart, is a preventative medicine, rather than treating the body once it is already in a state of disharmony or disease. If you'd like to know more about acupuncture and how it might help you, please feel free to give me a call. I look forward to hearing from you and wish you well.